I thought I'd record a short video today. We are facing an increasingly challenging situation with COVID cases continuing to rise rapidly in the Trust and across Herefordshire. We're now working at the highest level of escalation in the county. We've had more outbreaks in the Trust, more wards that have had outbreaks of COVID, and in the general population the numbers have risen again and are now at 350 per 100,000. The next 3 weeks are likely to be extremely challenging for all of us. We've reopened the staffing cell that we had in the first wave, and that's under the leadership of Kath Davis. And that's there to support staff to be redeployed, sometimes at short notice, from one area to another, so that we can meet the needs of the patients who need us in the best way that we can, given the stretched resources that we've got. We're cancelling all training unless it's absolutely essential, and we're cancelling all meetings. There's a particular need to support ITU. We're doubling our ITU capacity from 8 beds to 16, and that's a very significant staffing requirement for us to be able to do that, both to support our own patients in Herefordshire and Mid Powys, and to support the region, which is under increasing pressure. You all know what you need to do to keep your colleagues safe, both in terms of preventing the spread of the virus as well as looking after each other. It's really important to be kind to yourself and to be kind to the people you work with. We do have access to individual support available and a number of resources, and they're all available on the intranet. If you are frontline staff working with patients, it's really important that you conduct your lateral flow tests twice a week and you report the results of that. We know the lateral flow isn't a perfect test, but it does give us an indication of where particularly we've got asymptomatic staff who may be inadvertently infecting their colleagues or their patients. A number of you I know have already accessed the vaccine, and if you haven't, there's more availability, so please book for your COVID vaccine, and if you haven't had your flu vaccine yet, there's still a few of you left with that flu vaccine. Please do access that. I know a number of staff are somewhat uncomfortable that the government has decided to move the second dose from 3 weeks to 12 weeks, but it is a national policy, it's a national instruction, and as a trust we are supporting that. It's the right thing to do so that we can vaccinate more staff, more patients, more members of the public who are at high risk more quickly as the new variant of the virus is increasing right across the country, and we've all seen that. I think the big message on all of this is act as if you have the virus. And if you had the virus today, what would be the things that you would do to stop you spreading it from your colleagues and your patients, and do those things. If you see poor practice, if you see poor compliance with infection prevention measures and guidelines, then it is all of our responsibility to politely challenge that with people who we see are not complying, because we have spread in the trust as well as in the community. If you can, of course, work from home. Many people have been doing that for many months now, but if you can spend more time working from home, then please do so for the next couple of months at least. Thank you. Thank you to everyone. We know how difficult this is and how hard everybody is working. The vaccine programme, we can all see that light at the end of the tunnel, but it is some weeks and possibly months away. So most of all, keep yourselves safe, keep your colleagues safe, keep your patients safe, and thank you for all of your hard work.